Hi, I'm Dr. Courtney Howard. I'm an emergency physician in Chief Drag East Territory, the traditional lands of the Old Dene and the North Slave Métis. Right now I'm in Oxford. I wish I could be there with you in Inuvik. That's where I first came to the North as a family practice resident almost 15 years ago now. So thinking of all of you there, I miss the North. So I first became aware of the oil sands as a potential risk to human health when I watched the Tipping Point documentary. Of course, Elder Paulette and Dr. John O'Connor were both people in there. And it made me concerned living downstream from the oil sands as they did. So I did a literature review about 10 years ago and was very surprised to find almost no health studies in the peer-reviewed literature. Bill Erasmus was there at the Canadian Medical Association General Counsel when I proposed a motion asking the Canadian Medical Association to support increased peer-reviewed studies into resource extraction projects, and that did pass. But despite that, we haven't had the studies that we need. And I'm just going to go through what little has been done. And I know Dr. O'Connor and Dr. Redvers will follow up. So immediately after that episode where Dr. O'Connor was really doing his very best to defend the community, and the numbers were in question, the Alberta Cancer Board did a report that found overall that the two gallbladder cancers, cholangiocarcinomas, they found to be in the normal range. They found the overall cancer rate was higher than they expected, and they found higher than expected levels of cancers in the blood and lymphatic system, biliary tract cancers overall, and soft tissue cancers. And the thing with any study looking for relatively rare diseases like cancers that is being done in a very small community is that a small number of cases can make a big difference in the results. But because there are so few people in the community, the statistics are very difficult to work out in a precise manner. And this is something that is always going to be a problem if what we're looking for is only cancer rates, because they take years to develop after an exposure. They're relatively rare, and all of our communities downstream are very small in population. And so in any further studies, we need to make sure that we're looking at more than cancer, because the map is just not designed to be able to let us really come to strong conclusions in the type of communities that we live in. And we need to be really, really firm with government that more complex studies are required. The follow-up study done by the Alberta Cancer Board in 2014 showed that all cancers combined, they found that the overall number of new cancers showed no significant difference between observed and expected. They found a slightly higher number of cervical cancers. They found higher levels of cancers, non-Hodgkin's lymphoma. And they did find that for a short period of time between 2002 and 2006, biliary tract cancer incidence was higher than expected. But during that period, the follow-up period, it wasn't higher. But again, just like we'll always see in any study looking only at cancer, they said because of the small population, just a few cancer cases can make a significant statistical difference in the cancer incidence rates. They said they would continue to monitor the area. Now, a very well-known study that came out was done by the Royal Society of Canada expert panel. This is older now. It was done in December 2010. This is a very high-level panel of some of Canada's experts. It was multidisciplinary. It's a very long read. On the whole, they found that the reclamation is not keeping pace with what is required, and that current practices for obtaining financial security for reclamation liability leave Albertans open to major risks. This situation has continued to this day. They found no credible evidence of environmental contaminant exposures at levels needed to cause human cancer. They found, however, that impacts on population health overall, because of the boomtown health effects, many people coming to the area, inadequate health services, et cetera, that there had been ill impacts on the population right in Fort McMurray. They also noted in detail that more monitoring focused on human contaminant exposures was needed to address concerns. And subsequent to this, there was a new monitoring program that was brought into place. However, a survey that you may have seen on the news last year showed that when they surveyed the people involved in that program, they didn't feel that they were doing a good job, or that they were talking to one another, or that there was an overall plan. So everything really that's been written about the monitoring around the oil sands region has indicated that the programs have been inadequate. Now, this is a really lovely study, and it's the type of study that we need to see more of going forward. I spoke with the author of this report a couple of years ago, and he said, look, we found enough red flags that we need to do a follow-up study with bigger numbers. We need to make sure that that gets published in a peer-reviewed journal. He didn't have adequate resources to move forward with that, but that's the kind of thing that we need. So this was done very much in partnership with the Mikisew Cree First Nation and the Athabasca Chippewa First Nation. Traditional knowledge was part of the study. They looked at contaminants in traditional foods, and they asked people how it felt. So there was a certain amount of interview-based data that allowed people to communicate how they felt right now. And that kind of data is really important, because cancer studies, we know it can take years for a cancer to develop. And so it makes it difficult for us to do a study now and act on it, because we need to make decisions right now about cleanup, et cetera. And it's difficult in the absence of this information, these problems that might not show up for many years, but people can tell us right now how they're feeling. And we need to take that information really seriously, because that can help guide our decision-making right now. So they wanted to evaluate contaminant levels in the environment and culturally important foods, identify potential exposures to community members, detail the implications, if any, for well-being, and then see what suggestions emerged for better risk communication. So when they looked at levels in traditional foods, they did find elevated levels of arsenic, cadmium, mercury, and selenium, and polycyclic aromatic hydrocarbons, particularly at levels enough to affect children. However, because the community members were worried about eating these fish and also the land-based foods, they'd started to shift away from traditional foods to store-bought foods to avoid eating what they perceived to be potentially contaminated foods. So that actually meant that their overall levels of consumption of these foods were okay. And so essentially they were already shifting away from food that they perceived as potentially risky, and were in a way protecting themselves from the risk. So what they found was that it was notable how many participants no longer consumed locally caught fish because of government issued consumption advisories and associated human health concerns, and also the human exposure rates to the contaminants were therefore generally not of health concern. This reflects the relatively low amounts of traditional foods now consumed as community members transition towards store-bought foods. Now we know that in remote communities, the store-bought foods that are even remotely affordable tend to be those that sit on the shelf for the long time. And so that tends to be things that are not as healthy as what people were previously eating on the land. So this actually increases health risks from diabetes, from heart disease, et cetera, which is not a healthy solution to the problem. And at the end of the study, there's a really helpful list of recommendations, and one of them is that a comprehensive long-term baseline health study that meaningfully involves all affected community members be done in an inclusive and culturally appropriate manner with regular updates and community meetings. And so this was recommended in 2014. This is the study that we need to do that hasn't been done yet. And Dr. Redvers and Dr. O'Connor will be talking more about that. Now, a study came out looking at air pollution. I actually ran around the oil sands last year, and it is smelly. I'm not surprised that people there are worried about air pollution. And it turns out that what evaporates are the gases and tiny particles that are coming up off of the oil sands region do combine to make really high levels of air pollution. At the time this study was done, they hadn't done population level exposure, but it does show us that the potential for high levels of air pollution exposure exists. Now, I have been a physician in Yellowknife now for 12 years, and the fact that this research hasn't been done is one of my greatest sources of distress as a physician. We need to respect what community members are telling us. I have been in the room when Ariel Donalje, then the communications director of the Athabasca Chippewa First Nation, got a standing ovation at Harvard calling for these studies, and then went on to give the keynote at the world's biggest Public Health Association conference. And I was also in the room when Elder Paulette gave a keynote at the World Health Organization conference at the climate change negotiation a couple of years ago, again, making the case for these studies. So I could tell you that being a local doctor, seeing my community members need to go to the international community to ask for help, it's very sobering. And I've done what I can to ask conventional medical doctors to do these studies. I will continue to push for it. And I just am really glad we're having this conversation, because it's past time, and people in the oil sands region and downstream deserve to have all of the research knowledge, the health knowledge that Canada can bring to bear on this, brought to bear on the topic to alleviate fears and improve the situation. So I'm sending you lots of love from Oxford, and I look forward to the discussion.